My name is Lisa, I am 34 and my recovery goal is to see my kids graduate from school and eventually get married.
My name is Kevin, I'm 72 years old. I just want to feel well and enjoy my life and kick the cancer once and for all.
My name is Jeanette, I'm 53. My goal is to travel and enjoy life.
I had a stage 3 non-small cell lung cancer, and it was incurable and inoperable. And I think I just numbed out. I just thought, it can't be. I mean, I don't smoke, or I did 43 years ago, I stopped smoking. But, you know, I've lived this pretty clean, healthy lifestyle, and bang, here I am. I've got lung cancer, of all things. I think when they told me that I had cancer, I felt, I've just been given a death sentence. And I didn't at that stage think that there might be a possibility that I could well survive it, which I have. I went to a couple of workshops at the Olivia Newton-John, and they were good. I got a lot of information from those. I read a lot of the information that was available from the library. That was also helpful. I did become a little bit overwhelmed with the information and thought that maybe I should just simplify things by just following the direction that I'm given from the oncologist and take the medication, try to do as much exercise and help myself as much as I can, have a positive outlook and try to come to grips with it. So that was my approach.
Initially, I felt relieved that they had found something in my lung, but then the confusion came because they weren't sure exactly what that was. So I knew I had lung cancer, but I didn't quite know what the extent of it was, and that took quite a long time in my duration in hospital, and it was very overwhelming. There's absolutely a stigma associated with lung cancer. I'm young, never touched a cigarette in my life, always been very fit and healthy. I ran my own sports medicine business. I studied about the body for 7 years at university, so I was well aware of what it meant to look after your body. So for me, it was a massive shock. So I was consulted by numerous specialists every day, and there were times when family did come in and ask, who saw you? And I had absolutely no idea. So one strategy a friend had suggested was to use a notepad and pen, and every time someone came into my room and introduced themselves, I would write their name down. I'd even stop and ask them to spell it if I wasn't able to articulate what it was that they were saying. So then I would take notes as they spoke, and that just helped me to then relay that information on to family members who weren't actually able to be present at the time, because doctors do come in unexpectedly, I guess. And that was a fantastic strategy for me.
I mean, the process of diagnosis was fairly lengthy, and I think probably was easier to deal with because I was sort of dealing with each stage, not knowing where the next stage would be. Had the lobectomy, they were fairly certain they took some lymph nodes and thought they looked clear, but they did say they had to send them away to the pathology. It can take 4 weeks. I sort of didn't really hear that side of it, and I set about just preparing myself going back to work, and I went to see my surgeon 4 weeks after the operation, just ready to get signed off to start work on the Monday, and he dropped a bombshell and said, you've got cancer cell in my lymph node, so he recommends I have the adjuvant chemotherapy. When I moved cities, I had an opportunity to then interview my own medical team, a GP that was recommended to me, the oncologist that was recommended to me. So I had meetings with those people, and I have to say that that was really satisfying, just the fact that they would put the time in to listen to my story, look at my scans, and I felt like I was a person and that there was some hope there.
The treatment that was offered to me was a chemotherapy, an oral chemotherapy, which specifically targeted lung cancer. And they decided that that would be the better one of any for me to take. They decided they would do something which was called a pleurodesis. That is an operation where they seal the pleura to the lung, and that was carried out, but I got better and better after that. I could breathe better and I could feel myself getting my strength back, and the fluid wasn't building up. That treatment option was, I think, the best, but I still stayed on to the other medication that they prescribed, the chemotherapy, the oral one, and I'm still taking that today.
At the time, I thought of as many questions as I possibly could to ask them. Obviously, it's really difficult because there's so many emotions going on at the time. However, I didn't necessarily have many options to consider. They presented the one, and that's what I had to go home and think about.
The treatment decisions, because I had moved from the city to another city, so I changed medical teams. So in a way, I had a second opinion, I guess, which was fortunate. He talked to my surgeon. They looked at they did another PET scan, looked at my scans, and they determined that that my surgeon was prepared to actually operate, and where I'd had the first lobectomy first, decided that he could do a full pneumonectomy, take my whole right lung away. It is radical surgery, but given I had all the other health factors and I was young, that they felt that I could actually cope with that. So that's what I ended up doing, and of course having the lung removed with the cancer has meant that I haven't had to have any chemotherapy at this point. When I had to make the decision about that, and I thought, how am I going to check what they would do if they were in my shoes? And I thought that was the best way to approach it. So I said, if you were exactly me and you had the health benefits, what would you do if you were faced with this position? And each of them had said they would absolutely have the pneumonectomy. And it just satisfied me in my mind that I was going about the right way, the right pathway for me.
Dieting and exercise are critical, and I chose to walk every day as much as I could, push myself as much as I could, and I now walk up to 5 kilometres a day in the morning, and I go to gym 3 times a week. Now, after I came out of hospital 18 months ago, I could barely do those things, and it's taken me 18 months, but I kept pushing and pushing until I could do that. And the exercise, I think, has been the critical thing really in me getting back my health. After I was diagnosed, I decided I would join the local clinic where I live. And I found a new doctor. She put me on a program, and I have received fantastic service from the clinic. They have also a dietitian, a physiotherapist, and I went there and I showed them all the exercises I do. I'm getting help from not only the Austin Hospital, the Olivia Newton-John Centre, but I'm also getting help from the local clinic, which has been fantastic. So at first I didn't know where to go or who to see, but I found all these services are available and they've been really good.
It's not necessarily a battle. I don't believe dealing with cancer is much of a battle at all. It's just about knowing your limits, and it's just about, enjoying every day, enjoying your life. It's a lesson that we need to listen to, we need to learn from. It's not about trying to withstand, the worst possible side effects of these drugs. And the doctors are the ones that need to guide you through that. Over time, once I consulted with my oncologist, it was every 3 weeks, they would often talk about what the side effects were I was experiencing and discuss whether they felt that was appropriate or not. in their eyes, it was about living a relatively normal life and a good quality of life. So I guess having my husband there at all those appointments, he was able to see the medical point of view and he was able to see my point of view, and that really helped to enlighten me into which direction I needed to go. My initial call was not to reduce my medication, but that only lasted about 4 more days, and I was at the point where I was that bad, I just couldn't cope. So I made a call to the hospital. They said, come in, and they consulted with me and we reduced my dose. That was the first time. In terms of the support, I found that it was a little bit mixed. There were those who were very supportive and comforting, and that was their approach. There were others that would say more the old school method, which is how I guess I was approaching it, which is, oh, well, it's just how it is, you are dealing with cancer treatment. It's not just a, standard disease or diagnosis. This is a life-threatening condition you're dealing with. Of course you have to battle this. So it kind of was very challenging for me because I didn't know which way to approach it. And as much as that was their way of supporting me and encouraging me to continue, it was also a bit disempowering because I felt that I wasn't coping well and I was too scared to say that. And in terms of diet, absolutely, I just reevaluated what it was I was eating. I think the issue for me came when I lost so much weight that I thought what I was eating was quite good, but yet my body wasn't absorbing it. So I did a lot of work with a dietitian, and she helped me to change my way of thinking and go the high fat, high protein to help put on that weight again. And although I didn't see the changes instantly, it happened over time. So I think being patient was really important. Yeah, look, when I was originally diagnosed, there wasn't much out there in terms of support groups, and I actually became involved in a really newly developed support group. It's the only face-to-face support group in Victoria. And then there's been the Lung Foundation, who are an amazing organisation that provide quite a lot of resources, similar also to the Cancer Council.
Absolutely. I needed to stay positive. I needed to look after myself. Always tried physical activity. Sometimes that was hard on chemotherapy when you're feeling pretty ill, but certainly always try to do some sort of form of exercise each day. If you've got a few days of feeling well, take that little trip away, because like I realised, you just don't know when that's going to change, and it's taken away from you. So try to do it if you can. At the start, I was probably all consumed with cancer, and I've realised as time goes on, what does define me is not just a cancer patient. I'm a mother. I've got other things going on in my life, and it's important for me to keep going with those things too. My eldest daughter has wanted to be very involved with my treatment and treatment decisions. She came with me to all my appointments, and she was my ears, and she wrote everything down. The support has been critical. I think it's important to look after the holistic self, not just focus on the cancer itself, but on your physical, mental well-being also. So when I had the pneumonectomy a year ago, as I said before, I was told that it was very major and that it was, going to be quite a change from going from 2 lungs to 1 lung. So I did not understand the severity of it, really, I guess. And it wasn't until I got home and realised, how breathless I was. I went to my GP about this because it just didn't seem that I was getting anywhere. I was plateaued, I guess. So my GP had done a lot of ringing around, and found a respiratory physician in this city because I was a unique situation. So immediately I got an appointment to see the respiratory physician, who checked me over and referred me straight through. And that was probably the best decision I've ever made in terms of my recovery. It's done in a monitored environment. I'm gently exercising, but everything's controlled. All my numbers are monitored. My charts are recorded. I can see the progress. It's gentle. I've been doing that for the last 9 months, and I just haven't looked back. I've just gone from strength to strength, and my GP was the linchpin in coordinating all this support, the pulmonary rehab, the respiratory physician, and definitely throughout this process, communication, all talking, all being in the loop, has been important.
Well, first of all, I think, I try not to think of cancer, right? What I think about is what I'm going to do during that day. I'm going to go for a nice walk, I'm going to go to gym, I'm going to do something, but I don't want to think about being sick or getting or cancer coming back.
To get through each day, I would often wake up every morning and think of 5 things I was grateful for. And I wouldn't get out of bed till I had done that. My daughter would often run into my room and say, Mum, the sun's up. And I'd look at her and I'd say, yep, the sun is up. It's a new day and I'm alive.
Some of the strategies that I used to keep myself going during this whole period certainly was most beneficial was the use of a psychologist, and that was referred by my GP because my head was spinning with 1,000 thoughts, and I just wasn't able to focus on any one thing. And I sort of thought I had so many things to do, so it went through my mind, I need to get everything in order, I need to simplify my life. So I started seeing the psychologist that my GP had recommended. We had a really good connection, and we talked about strategies, and she certainly taught me meditation, living in the moment, living in the present, the worrying thoughts that I used to get through every night and I wasn't sleeping. She would say, do your meditation, work from your toes up, and then park the thoughts. Music was a big part of my life. I had theme songs for my different emotions, and when I was angry, I'd play some great songs, and I'd feel really good after I'd sang them out really loudly. And my daughters, they found that useful as well. We used to do it together. So music was certainly a big part of it.